Hi class, this is my probably 50th attempt today to make this video. I've been working on it for about 8 hours now. It's been a stream of mishaps. Anyway, let's see if I can finally do this one. So the respiratory system, this is respiratory system part 1. Thank God I already finished part 2. Let's go through the functions of the respiratory system real quick. Gas exchange, of course. We need oxygen. All our tissues need oxygen to survive, and we need to get rid of that CO2. Vocalization, what is vocalization? That is using our vocal cords to produce sound. And olfaction, smell, we have our cranial nerve 1, the olfactory nerve, sitting on our cribriform plate with little sensory receptors hanging down into our nasal cavities so we can smell. So the organs of the respiratory system. The respiratory system is not that hard. It's just a short little system going from the nose to the alveoli in the lungs. That's it. So what are the structures we're going to go through? We're going to go through the nose, the nasal cavity, down into the pharynx that has 3 parts that you'll learn, down into the larynx, which houses the vocal cords, into the trachea, the windpipe, into the bronchi, which are the tubes that carry air into our lungs. And once we get into the lungs, we're going to have smaller and smaller tubes that are going to take our air to the site of gas exchange, which is going to be in the alveoli. So, what you need to know, if someone says, what is respiratory epithelium? You need to say respiratory epithelium is pseudostratified ciliated columnar epithelium, PSCC. Remember this from week 1 of anatomy? This is respiratory epithelium. Here is your basement membrane. Here is our pseudostratified, meaning it's not really stratified. It's only 1 layer thick. It just looks stratified. Here's our cilia. What are cilia? Motile hair-like extensions. So they are moving in one direction. Here are our goblet cells. Lots of goblet cells in our respiratory system. So they secrete what? Sticky mucus. Lots of mucus. Remember I told you why smokers have problems? They have to cough every morning because the nicotine and the cigarettes paralyzes the cilia. Cilia cannot move. The mucus stays collecting here. So every morning they have to cough out all this collected mucus. So don't smoke nicotine cigarettes. Another type of epithelium that you're going to have in these tubes, you may have a few other choices, and it's going to be stratified squamous epithelium. If that tube carries not only air but food and water, it's going to have stratified squamous epithelium. And only once we get into the respiratory zone where gas exchange takes place, only then will we have simple squamous. Simple squamous, 1 layer thick, it's flattened cells, so quick diffusion. So I think that's all I wanted to say about that one. And here we come to Mr. Skull. Do you remember this bone down here? The inferior nasal concha. We had a middle nasal concha and superior nasal concha. You can't see them, but they're back in here. Middle and superior nasal concha belong to the ethmoid bone. Here we have the nasal septum. The nasal septum is dividing the nasal cavity into 2 areas. So we're going to have these superior, middle, and inferior nasal concha lining the lateral walls of the nasal cavities. So let's look at those. Oh, the only structures we're going to be covering for this video are the upper respiratory tract structures, which are going to be the nose and its associated structures, the nose, the nasal cavity, the paranasal sinuses. Para means around. Nasal, the nasal cavity, which is going to be the frontal sinus. The sphenoid sinus, here's your sella turcica, so you know it's the sphenoid. So the nose and its structures, the pharynx, the back of the throat, and the larynx. So if you have pharyngitis, that is an upper respiratory infection. If you have laryngitis, which has to do with the larynx and the vocal cords, that's why with laryngitis you kind of talk funny. That is an upper respiratory infection. If you have any sinus infection, that is also an upper respiratory tract infection, a URI, upper respiratory infection. So on this picture, I'm going to get green here, we're going to have our air come in through our external nares. External nares is a fancy term for nostrils. They're going to bring the air in to this first portion of our air passageway is going to be the nasal vestibule. So the nasal vestibule is this entrance into our nasal passageways. Anything that ends in vestibule just means it's a passageway. So what does your nasal vestibule look like? If you look up your nose, what are you going to see? You're going to see this. These are nose hairs, and they're called vibrissae. Vibrissae. Why do we need them? Are they just there for looks? No, they're our first. These are our first guards that are guarding our passageways, and they are filtering out large particles, like large inhaled dust particles that you may be inhaling, those little gnats, little insects that are buzzing around. If they get stuck in here, hopefully these vibrissae will filter them out. So kind of cool what they're there for. Let's go back to this picture. So I wanted to go into, I always have to do we're going to go into the nasal cavity here. So here's our nasal cavity. The nasal septum's been removed, so you're just seeing the lateral wall of the nasal cavity, of one nasal cavity. And here are our superior, middle, and inferior nasal concha. But now they've been covered with respiratory epithelium, which is PSCC with goblet cells, so lots of mucus here. Why do we have them here? Well, if we didn't have them here and we breathed the air in, the air would go straight to the back of the throat. But since we have them here, that air is now going to hit these nasal concha, and it's going to cause the air to flow in this kind of pattern. These are little eddies of airflow, and it's causing turbulence in the airflow. Why would we want turbulence in the airflow? Because it slows down the air, number one, and now it's giving the opportunity of more contact with the respiratory mucosa that's lining our nasal cavities. Why do we want it to do that? Well, we have lots of mucus in our respiratory mucosa, yes. So this is sticky mucus. So if the vibrissae didn't catch everything, you now have this mucus, sticky mucus, where any inhaled nasal particles can be now stuck onto that, trapped on that mucus. Also, the mucus is going to humidify, add moisture to that air that's coming in. And with this increased surface area, the air is now going to be exposed to lots of blood flow that is underneath the nasal, this respiratory epithelium, lots of blood flow under the respiratory epithelium. If you've ever had a nosebleed, you know there's lots of blood flow. So what's that going to do? It's going to warm the air, especially if there's cold air. If you're breathing in cold air, it's going to give a chance to warm up that air. That's why we're always told, breathe in through your nose. It's going to be able to warm and humidify inhaled air. So just directly behind the nasal cavity, we're going to have the internal nares right here. Here's the external nares, internal nares, and now we're coming to the throat. We've got three sections of the throat, the pharynx. Let me get another pin color here. Let's do blue. So we're going to come to the nasopharynx. The nasopharynx is the first part of the pharynx. It's directly behind the nasal cavity. It's going to start directly behind the nasal cavity, and it's going to end at the soft palate. So it's going to be in this region right here. So this is the soft palate. Here's the hard palate. Here's the soft palate. So air is coming in. It's going into the nasopharynx. This is air only, so what kind of epithelium would you have? Respiratory epithelium, PSCC. And we have two other structures here. We have the entrance into the auditory or eustachian tube. So if you ever try to pop your ears by holding your nose and blowing, you're blowing air into this tube and popping your ear. This eustachian tube connects directly to your middle ear. And we have a tonsil here. We've got three tonsils in this upper respiratory area. This first tonsil is called the pharyngeal tonsil, aka adenoids. What are tonsils? They're lymphoid tissue. Lymphoid tissue has lots of white blood cells. They're part of our immune system. So they are there to stop or help stop any any pathogens that are trying to get into your airways. So that is the nasopharynx. Then we are going to come to your here it is, oropharynx. Oropharynx, because it's behind the oral cavity. Here's the oral cavity. So the oropharynx is going to start at the distal end of the soft palate, and it's going to go all the way to the level of the hyoid bone, so about right here. So this is the oropharynx. So the oral pharynx is receiving food and drink from the oral cavity. So what kind of epithelium would be here? Stratified squamous, non-keratinized epithelium. And we're going to have another tonsil here, the palatine tonsil, just inferior to the soft palate. This is the palatine tonsil. And on the tongue, we're going to have the lingual tonsil. Again, these are lymphoid tissue filled with white blood cells, part of your immune system, your lymphatic system. So that's all I wanted there. And then the last part of the pharynx is going to be the laryngopharynx. And it's going to start here where the oropharynx ends, and it's going to end, at the level of the esophagus. And here's where the esophagus starts. So here's the esophagus. Food's going to go down the esophagus. So this is the laryngopharynx right here. What kind of epithelium here? Food and drink. So it's going to be stratified squamous. So I think that's all I wanted to show you on this slide. This is your chart. We'll go through it real quick, and you should know this by heart by now. Number 1, nasal vestibule. What kind of epithelium? Stratified squamous. What structure is in here? The vibrissae, the nose hairs. Here's your nasal cavity. Superior, middle, and inferior nasal conchae. What kind of epithelium lines the nasal cavity? Respiratory epithelium, PSCC. Frontal sinus, sphenoid sinus. Here's the entrance into the station or auditory tube. Here is the nasal pharynx behind the nasal cavity. What kind of epithelium? PSCC. Here is the oral pharynx behind the oral cavity. What kind of epithelium? Stratified squamous, non-keratinized. Here is the laryngopharynx. What kind of epithelium? Food and drink, stratified squamous, non-keratinized. Number 7, here's your hard palate, here's your soft palate. The distal end of the soft palate is the uvula. We'll look at that in a second. Structure number 8 is your epiglottis. We'll look at that shortly too. This is part of the larynx, and it is elastic cartilage, this epiglottis. It's going to cover the airway, go down and cover the airway when you're eating and drinking, so food and drink don't go down into the airway. 13 is the vocal fold or vocal cords. This is down in the larynx, so number 11, this is going to be thyroid cartilage. It's a big plate of cartilage that's in front of the vocal cords. It's protecting those vocal cords. Inferior to the thyroid cartilage is the cricoid cartilage. Small in front, but the cricoid cartilage goes all the way around the air tube. Thyroid cartilage does not go around the air tube. It is only in the front. And then this is going to be the esophagus, and inferior to the cricoid cartilage is going to be the trachea. Another model, internal nares. This is the hole, the nostril, vestibule, superior, inferior, superior, middle, and inferior nasal concha, frontal, sphenoid sinuses, entrance to the auditory canal or station tube. Here is, the pharyngeal, pharyngeal tonsil. Here is the nasal pharynx, hard palate, soft palate, uvula, palatine, tonsil. This is the oral pharynx, laryngopharynx, esophagus, entrance into the larynx, epiglottis, vocal folds, aka vocal cords, thyroid cartilage only in the front, cricoid cartilage in the front and back, makes a ring around the airway tube, and trachea. I think we covered everything. Just make sure you know the epithelium that lines all these passageways. Here is the uvula. This is the soft palate. Here is the uvula with the palatine tonsils. Don't go saying, I want my tonsils out. These are protecting you. If they look like this, it means they're fighting an infection. So they are fighting an infection. They are preventing whatever's in here from reaching your lower airways. So why do we need a uvula and an epiglottis? So here's the oral cavity. You chew your food, and it makes a bolus of food. As the tongue pushes the bolus of food to the back of the throat, the uvula is going to go up and close off the nasal cavity so food or drink don't go into your nasal cavity. Obviously, sometimes that doesn't work, and we squirt. Usually it's liquid out your nose. And does it burn a little bit? Yes. Why does it burn? Because it is only respiratory epithelium up here. Pseudostratified ciliate columnar epithelium. It is not a thick epithelium. The epithelium back here in the oro and laryngopharynx, where this food is going to go down, this is stratified squamous. No problema. This is thick wear and tear epithelium. So the food is the bolus is going to be pushed back, and then this epiglottis is going to come down. The epiglottis comes down. The food is directed into the esophagus, and the food is not allowed into the air tube. Obviously, sometimes this epiglottis doesn't work quite right, and we say the food went down the wrong tube, and we choke. What else did I want to say here? The epiglottis is called the guardian to our airway because it is protecting our airway from food and drink. I think that's it for this slide. Here is the larynx model in our classroom. Here's the hyoid bone. Here's the thyroid cartilage. We said it's only in the front. Thyroid cartilage only in the front. We can see the thyroid cartilage here. It stops here. It does not come around to the back. This is cricoid cartilage. So thyroid cartilage only in the front. The middle section here, it's prominent. We call it the laryngeal prominence, aka the Adam's apple. It sticks out. You can see it in males pretty well. What else do you need to know about the thyroid cartilage? It's made up of hyaline cartilage. This is our epiglottis. Epiglottis shown there and shown here. What kind of cartilage? Elastic cartilage. The vocal cords are going to be housed in here. Are going to be housed in here. Just inferior to the thyroid cartilage is the cricoid cartilage. Number 2 here. The cricoid cartilage goes all the way to the back. This is all cricoid cartilage. It is also hyaline cartilage. I want to get red here. Once we're inferior to the cricoid cartilage, this is the start of the trachea. So we're going to have cartilage rings on the trachea too, and we're going to call them C-rings. The C-rings of the trachea, they're C-shaped because they're like this. This is the front, and in the back there's no cartilage. Here is the back. Here is the cartilage. No cartilage all the way in the back. So they're making like a C-ring here. What's just deep to the trachea? The esophagus. So why do we not have our cartilage going and making a complete ring of cartilage all the way down the trachea? Well, this is the esophagus, and if you have a big bolus of food and you didn't chew it properly, if we had C-rings here, cartilage, C-rings, if we had cartilage all around the trachea, it would prevent, there would be no give, and you could choke on that, or that food would not be able to go down the esophagus. You wouldn't choke on it. The food just wouldn't be able to go down the esophagus. Hopefully that makes sense. I'm really tired. But anyway, so the cartilage rings do not make a complete circle to allow food that's going down the esophagus that can push in on the airway to allow food to go all the way down without getting stuck. Hopefully that makes sense. What do I have next? This is a real picture. of your epiglottis. Here's the model of the epiglottis. Here is the vocal cord, aka vocal fold. This is the vocal fold. Here is the vestibular folds, aka false vocal cords. Here is the entrance into the glottis. The glottis is the entrance into the airway. That's why they call this the epiglottis. What else? You can kind of see the trachea C-ring here. I will try to show you this YouTube video of Steven Tyler's vocal cords while he's singing. It's really cool. Once you see it, you will understand how vocal cords work. I can't explain it by looking at these. Here you can see some more vocal cords. Vocal cords, when they're closed like this and air is forced out in between them and the vocal cords vibrate, that is how you're going to produce sound. But watch Steven Tyler. You will see his vocal cords vibrating off the charts. This is showing you a vocal ligament. It is not covered with epithelial tissue here. This is covered with epithelial tissue here on the vocal cord. This is a vocal ligament. It's just a ligament. Here we're connecting cartilage to cartilage. Once we surround it with epithelium, and we are going to surround it with our toughest epithelium, which is what? Stratified squamous epithelium, wear and tear epithelium. Lots of wear and tear on these vocal cords. That's why lots of singers have vocal cord bleeds, vocal cord nodules, because of the trauma from these vocal cords smashing against each other. Is that it? Yes. Here's the last slide. Here's the torso model, hyoid bone, thyroid cartilage. Here is a thyroid gland. Here is the trachea. And you can see the C-rings of the trachea, the front part of the C-rings, the trachea. Here's the distal end of the trachea. And here's the esophagus. Just wanted to show you how the esophagus runs deep to the trachea. So that's it. And now on to respiratory system part 2.